If you're advanced in your age or you're not well versed in medical procedures or terminology, it could be very confusing for you as a patient.
For me, I just felt like it was a really fragmented system. It works fine if, you know, you're young and you have the need to see a doctor 4 or 5 times a year, and you come in and you get your visit done and you go on your way. But for somebody who really has a complicated medical picture, no one really keeps track of the whole picture, and no one really communicates the way that they need to. Our mother was a fighter in the sense that she knew how things were supposed to work. She was old school. She knew what good patient care was. She knew how to give a patient a bath. She knew that they shouldn't have diarrhea for days and days and days. She knew when a consult was appropriate. She knew all of these things, and she had no control over what happened. It just seems so restrictive when you have a complex situation that the doctors don't have any latitude to go beyond their limitations. So they can do the best that they can do with what they're given, and I understand that. I think appreciate the patient and the family members for what they have to offer in terms of information, because we know the people in our family the best, and appreciate when somebody has an anxiety about a condition, deal with it. Deal with it then. Don't put it on the back burner and think, well, maybe it'll go away between now and the next visit, or you know, let somebody else, let them come back next week and deal with it. Deal with it then. Take care of it then. Because
in the geriatric clinic, there's a captain of the ship, and that physician knows the entire case. So he or she knows that when there's a new issue or a new symptom or a crisis, he knows how that will impact the whole body, because he knows about the other condition. So he or she is able to address it quicker because they put in the time at the beginning of the case.
And there's just nothing that can replace having that consistency of, you know, a regular doctor knowing your whole picture. I understand the need for specialists, but when everybody's dealing with a different segment of the body, what she says is true. There's no captain of the ship, and nobody's steering the ship. They're just dealing with their little fragmented piece.
So I think if it comes down to accountability, then it has to be someone. It has to either be the primary doctor, or in my mom's case, she used her oncologist as somewhat of a primary doctor for much of her care. They knew each other for many, many years, and I think ultimately there needs to be a primary doctor that's accountable.